Dr. Lisa Ann Carey is a nationally recognized clinical researcher and chief of the Division of Hematology and Oncology at the University of North Carolina School of Medicine. Dr. Carey's cutting-edge research goes on daily here in the North Carolina Cancer Center at Chapel Hill and is supported by grants from the Susan G. Komen Foundation. Those funds are key to tracking and fighting a disease that some might say is a moving target.
The fact is that it's not as moving as it could be, and that's good. So cancers aren't totally different later on than they were. All of the elements, or a lot of the elements of the cancer that you see in the beginning, are still the same later on. But there may be some key differences that are important from the standpoint of treatment, and that's what we have to figure out.
The Komen Foundation grants were critical to bring together teams of researchers to better understand how cancer becomes resistant to certain drugs over time.
Traditionally, the trials sort of happen over here, and the tissue studies where you're trying to figure out the biology of the cancer are happening, from different people in a different time and place. And that's where these kind of grants really step in. They really give us the support to develop a system to try and answer questions together using different people who might not normally work together.
Komen was also key in providing data from thousands of women fighting cancer. That enabled Dr. Carey to move on to phase 3 of the Carolina Breast Cancer Study.
3,000 women with cancer, on which we built in collection of all the information about how they were treated, what happened to them, what didn't happen, did the cancer come back, didn't it come back, all of that, all of the detailed information was supported by Komen.
Dr. Carey continues that work today with ongoing funds from the Susan G. Komen Foundation. Still, she dreams of a bright future.
Our understanding of the biology of cancer means that just as it's going to help us treat it better, it also should help us prevent it. And I think that would be a great dream for all of us.